Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is hot off the press, released in JAMA Online yesterday. It's the CAUGHT-CAD trial. In the CAUGHT-CAD trial, the pretest, how did the use of coronary artery calcium scoring impact plaque progression in intermediate risk patients with family history of CAD? A. Coronary artery calcium scoring had no significant effect on plaque progression compared to usual care. B. The coronary artery calcium scoring prevention strategy led to a significant reduction in LDL levels and slower plaque progression. C. Coronary artery calcium scoring was only useful for detecting non-calcified plaque, no impact on total plaque volume. And D. Coronary artery calcium scoring informed patients with higher plaque progression due to the initiation of statin therapy. The CAUGHT-CAD trial was a randomized clinical trial assessing coronary artery calcium informed prevention strategy in 7 hospitals in Australia. 365 participants, mean age 58, with a family history of premature coronary artery disease, were followed up for a period of 3 years. Statin naive individuals with the coronary artery calcium scoring between 1 and 399 were randomized to a coronary artery calcium informed prevention strategy, which included 40 milligrams of atorvastatin plus education. And the usual care group was based on guideline-based risk management and no coronary artery calcium disclosure. The key findings: LDL reduction was significantly more in the coronary artery calcium informed group, 51 milligrams per deciliter, versus only 2 milligrams per deciliter in the usual care group. Plaque growth was less in the coronary artery calcium informed group. There was less non-calcified and fibrofatty necrotic core plaque progression in the coronary artery calcium score informed group. In summary, coronary artery calcium score informed prevention was linked to better lipid control and slower plaque progression. Clinical impact and conclusion: the CAUGHT-CAD trial, coronary artery calcium scoring helped asymptomatic individuals with a family history of coronary artery disease. In the CAUGHT trial, which was also published in JAMA recently, they used another imaging modality, that is coronary CT angiogram, which reduced coronary artery disease mortality and non-fatal MI in symptomatic patients with stable chest pain. And these were followed up over 10 years. Both these trials emphasize imaging-based cardiovascular risk assessment. Post-test, the correct answer for the multiple choice question was B. Coronary artery calcium informed prevention strategy led to a significant reduction in LDL levels and slower plaque progression.